So we're going to start off with okay, so in the following slides, we're going to be discussing how the 90 days sober milestone impacts our loved ones' neurology, their biology, their psychology, and their environment. Okay, so we'll start off with the neurology. So neurochemical studies have shown that large and fast increases in dopamine are often associated with the reinforcing effects of drug abuse, but also that after chronic drug abuse and during withdrawal, brain dopamine function is markedly decreased, and these decreases are associated with dysfunction of prefrontal cortexes and the limbic system. I'm going to explain this in very simple terms in a second. So the prefrontal regions most affected are the things in control of planning and appreciating future consequences and delayed gratification. So think of the prefrontal cortex really as the part of our brain that works like the brakes in a car, tells us to stop. Okay. And then the limbic system, which is very rich with dopamine releasing neurons, that sort of acts as our accelerator in very basic terms. This is the thing that tells us to really go, go, go. Right. And then dopamine itself is a chemical with many different functions, but the most important function is that it is our rewards, pleasure, and motivation center of our brain. Okay, we're not going to go too in depthly into this, but I am just going to speak to how drugs in particular impact the dopaminergic system. Okay, so every potentially addictive substance or behavior releases dopamine into our reward pathways. And the faster the substance or behavior releases dopamine, the more addictive it is. This is why there's so many drugs of this is why there are so many drugs of choice, because not every drug gets the same releases. So it's related a lot to the individual and what they get from that in terms of their reward pathways, but not all drugs will have the same sort of impact. So here I sound very soft. We'll just try and speak a bit louder. Okay. So in addiction, much of the literature believes that people suffering from the disease of addiction have problems with either the brakes, which is the prefrontal cortex, or the accelerator, which is their limbic system, or both, right? And the evidence also suggests that there are disconnects between these parts of the brain. So I really want you to think of these parts of the brains that firstly, the pleasure and pain kind of receptors within the brain. But within the brain itself, the brain always wants to balance these chemicals. So it's not just dopamine that plays a role inside of addiction. It's many other neurotransmitters. Dopamine just so happens to be one of the more researched and the more impactful in terms of addiction. But the brain always wants to try and create some kind of homeostasis, some kind of balance between the neurotransmitters in our brain, right? So what happens is when we do take the drug or we do take the substance or we do engage in the behavior, we get this rush, this release of dopamine in the dopaminergic system. But then the body says, hang on, there's way too much. And in very simple sort of layman's terms, there's a lot more to it in terms of the actual neurochemistry. But in very simple layman's terms, what the brain tries to do is just counteract that. And so it sort of activates the pain receptors inside of the body and says, okay, we're having too much of this one substance called dopamine. Let's try and reach a sense of balance again. That's very often why people go through cravings, why they go through hangovers the next day. Just as a sort of a mild example of the body trying to counteract the neurotransmitters being activated. Okay. So over here, I have a brain scan on the side here. And on the left, you see someone, this is pictures of the limbic system in the nucleus accumbens. On the right, on the far left are people who are not addicts, and you can see the little red zones there. That's the dopamine inside some sort of normal, healthy brain, where both the limbic system and the prefrontal cortex are still really navigating quite well together. The brakes are working, the accelerator is working in a very balanced sort of manner. On the right is what it looks like with someone in active addiction, right? Actually, believe it or not, these images on the right side are 2 weeks after someone's been sober. So the crucial aspect in terms of our neurology, in terms of neurotransmission and the chemicals that our brains produces, is that even 20 days isn't enough for the brain to start healing from the damage caused by the substances. So it turns out 90 days is just about how long it takes for the brain to reset itself and shake off the immediate influences of a substance. Researchers at Yale University have documented what they call the sleeper effect. This is a gradual re-engaging of proper decision making and analytical functions in the brain's prefrontal cortex after 90 days of sobriety. It also just so happens that many of the medications that are prescribed in order to correct the damage caused by the substances also take up to 3 months or 90 days to start taking proper effect. Some of the medications take even longer than that because of the extent of the brain damage that occurs within addiction. Okay, now that we got through the very complicated one, we'll move on to the sort of biological impacts in active addiction, right? So there's a many diseases that are associated with active addiction. So we can have cardiovascular diseases, respiratory diseases, neurological diseases, intestinal and liver diseases, kidney and urinary diseases. That one killed me a bit. Infectious diseases, metabolic disorders, skeletal diseases, reproductive and sexual health issues, mental health disorders, both substance-induced and co-occurring. It's important to remember that many of the mental health disorders that we sort of encounter with active addiction and even in sobriety can be induced by the substances themselves. So this person may have had some kind of, in inverted commas, normal trajectory within their normal sort of developmental lifespan, but the active engagement in the substance or the behavior induced some mental health disorders. Or they could have been occurring prior to the substance abuse and very often trigger the substance abuse too. And then we can also have dermatological conditions. Okay. So with alcohol, these are many of the biological diseases associated with active addiction. So liver disease, pancreatitis, cardiovascular disease, neurological damage. The neurological damage, the one we see most often is Korsakoff's. We also see forms of dementia, Alzheimer's unfold with alcohol abuse. In opiates, you see a lot of respiratory depression, especially when they are in overdose. You see infectious diseases. Yeah, with cocaine, lots and lots of heart complications. These heart complications normally stay throughout the lifetime. They're very difficult to correct. So if someone does have a sort of cardiac event through the use of cocaine, if they then take cocaine again, their risk is much higher. Stroke, seizures, yeah, methamphetamine, dental problems, psychosis, cardiovascular damage. With benzodiazepines, we see severe cognitive impairments. This one can be repaired a bit more in sobriety, but sometimes the impairments are so severe that they never do quite repair. Also respiratory depression, especially when combined with alcohol opiates. And that's once again something you see a lot more in overdose. So with inhalants, you see a lot of brain damage, liver, kidney failure, sudden sniffing death syndrome. With cannabis, lots of cognitive defects. Also, early onset dementia sort of kicks in there. Memory problems, very prevalent within cannabis use as well. And then obviously the mental health disorders. And then tobacco, I'm sure we know many of those by now. Okay. Then biology within 90 days of sobriety. So the extent of abuse normally dictates the extent of damage to one's biology. Not always, but in most of the cases. The body, like the brain, takes time to heal. And although many of these biological effects of substance abuse cannot be rectified, many can heal, or at very least the progression of damage can be slowed. So especially with the biological ones, it's sometimes not always important to try and correct the effects of the substance abuse, but at least slow the effects of the induced sort of disorders that came with the substance abuse. For example, like I mentioned with the cocaine usage, you're at much higher risk for cardiac events with prolonged cocaine usage. And so it's very important to slow the progression with that. So the trick with the biology here really is just sobriety all the way through. These deadly comorbidities are only worsened or exacerbated by substance abuse. So it's very important to cessate all usage. One can expect several improvements in health and lifestyle while in sobriety. These can include better sleep, improved liver function, clearer skin, increased energy, significant changes in your mood and mental health. Okay. Then just quickly touching on some of the more psychological aspects or domains that are impacted in active addiction. So our cognition is normally either impaired or affected. So we see problems with memory, attention, executive functioning, sometimes problem solving as well. Sometimes abstract thinking, creativity is also greatly affected. Creativity in particular is affected by cannabis usage. We see difficulties in emotional, affect, or mood regulation in active addictions. We see difficult behaviors unfold around active addiction. I'm sure many of us know what that looks like by now. Intrapersonal and interpersonal relationship difficulties. Intrapersonal just sort of refers to one's relationship with oneself. So if you think about that inner voice you have in your head, and the conversations you sort of have in your head with yourself, that's your intrapersonal relationship. So how the loved one in active very often talks to themselves can be also quite severely impacted in terms of psychology. And then obviously how they interact in interpersonal relationships, that's the relationships outside of them, are also severely impacted. Their self-concept and identity are also severely impacted. This is also due to many of the other consequences of addiction, like losing jobs, tumultuous family relationships, for example, then get internalized and then change one's self-concept and identity. One's motivation is quite severely impacted as well. It's largely due to the neurological effects, once again, of substance abuse, but also has a lot to do with the various external aspects surrounding their addiction. Their development is severely impacted. So we see often people should be at certain developmental milestones within their lives. For example, let's say we find a teen sort of young adult should be either fully educated at that point or immersed in some kind of career or immersed in some kind of passion or sort of moving towards more and greater responsibility. But you might find that in active addiction, that developmental sort of milestone is then impinged and they're a lot less responsible than they could be. Then obviously insight and awareness are greatly impacted. They're impacted for several reasons. Insight often is impacted by our defense mechanisms too. So the brain, the body, the mind, every aspect of the addict really wants to try and maintain their addiction. And so very often insight goes outside of the window just on that level in terms of defense mechanisms. So that they can continue to use. Obviously, insight is also impacted then by prefrontal cortex damage that occurs with substance abuse. So that's where the brakes really come into play as well. The addict really sometimes physically cannot put the brakes on. They physically cannot see the consequences of their using. And then obviously their routine and habits are impacted within the active addiction. Okay, so achieving 90 days sober is really important on a psychological level for a number of reasons. So firstly, emotional regulation. We see that very often with active addiction, you're also trying to avoid a lot of intense emotions and intense experiences. And very early on, when they go into sobriety, their emotions are all over the place. They're feeling a lot. And that's also why primary care is really such a tough environment for them in particular, because really the feeling is coming on. All those feelings that they've been numbing for so long are coming through. And how one has to do then is actually learn to regulate those emotions or learn to cope with those emotions. And that takes a very long time. But it starts getting dramatically better after 90 days of sobriety and also 90 days of recovery in particular. Okay. Then certain behavioral modifications also start occurring. This one's very much related to the next step around establishing and solidifying habits and routines. So it takes about 21 days to establish a routine, and then it takes about 90 days to actually establish that habit. So if a loved one can start that routine, engage with that routine, keep it going for 21 days, and reach that milestone, already the habit has formed, but it's very important to solidify that habit, and that really only occurs in 90 days. So a lot of the behavioral modifications, in particular, need very intense treatment, firstly, but then they really need quite a long amount of time to be solidified. Then obviously cognitive functioning can drastically improve, not always, but can, or mostly does. We see insight get better, we see judgment get better, we see their ability to reason become a lot better. And really the defenses also start dropping quite a bit. That's not always such a cognitive domain, but it's very much related to cognitive domains. And so yeah, they also become a lot less defensive. And after 90 days, we also see cravings greatly increase. So as much as cravings have a biological element to it, they also have a deeply psychological element to it. And reaching that 90-day mark is very important for trying to reduce cravings. And then obviously motivation. So in terms of goal achievement and then the futility of effort. So when we're talking about goal achievement, it's really important to set that goal. But then once one achieves it, it's actually obviously very rewarding. But beyond that, it's sort of quite a far milestone, and many people well, it's kind of a good thing, but many fall prey to the sort of sunk cost fallacy. So they've sunk so much time into sobriety. There's no point in really failing at this point, and that 90-day mark and reaching that goal is really important for that, because it's kind of like, well, I put all this effort in. Why would I want to stop here? Why would I want to throw it all away here? Not that it's 100% guaranteed that you've hit 90 days and now all of a sudden you're not going to relapse, obviously. That goes to say for, I think, everything we've discussed, really, that 90 days is a important milestone, but not necessarily the thing that's going to make you stay sober or keep you sober. Okay. And then just briefly touching on the environment so that we can get to some more questions. So in active addiction, we very often know what the environment of the active loved ones look like. So tumultuous family relations, very toxic friendships and social networks. They often have romantic and intimacy difficulties, occupational and professional impacts. That one's normally quite big and profound because it has a cascading effect in their environment and on their loved ones. Obviously, educational impacts, legal and criminal consequences, financial and economical consequences. This one is also normally felt a lot by the family. Obviously, the neglect of responsibilities, social developmental delays. We spoke a bit to that in terms of the psychological impact. Then poor living conditions and terrible hygiene. Okay, so what to expect within 90 days of sobriety. So by 90 days, individuals have had time to repair and strengthen relationships with family, friends, and others in their support networks. These connections can be powerful motivators and provide essential support, making it easier to maintain sobriety. Individuals often become more engaged in recovery communities, therapy, or support groups, fostering connections that reduce isolation. This is crucial in sustaining recovery. Isolation is both the sort of key predictor for seeing when a loved one is going into relapse, but it's also the key predictor in sustaining recovery, right? If you can really reduce that sense of isolation, one's chances of sustaining recovery will always be drastically improved. And that's why it's so important to engage with the fellowship and sort of the 5 pillars that your loved one may speak to or that we've spoken to in previous sessions. As they really do try and foster a greater sense of community. Okay, at this stage, many people will begin to feel a sense of pride and accomplishment for reaching this milestone. They're often ready to set new goals for their life beyond sobriety, which can include pursuing a career, education, hobbies, reconnecting with passions they may have put aside. This period allows individuals to start re-engaging with work, education, or family responsibilities in a meaningful way. That's the other aspect, really, in terms of the environment. The the whole environment really becomes encountered with a lot more positive features, and these positive features really give one a greater sense of meaning, but not just the addicted one, but their surrounding loved ones also find a lot of meaning in their recovery. Obviously, the financial burdens may not also be as strained due to the loved one not spending money on their addiction. Obviously, if you're in further treatment, the financial strains might still be felt because your loved ones might be spending that money to maintain their recovery. But keep in mind that that is a small cost to pay, being in longer term treatment as opposed to the loved one continuing for a number of years onwards and depleting the family's finances. Okay. After 90 days, many individuals have had time to also internalize key recovery concepts such as accountability, honesty, and self-reflection, also openness. The family and loved ones also begin to internalize their boundaries, bottom lines with regards to recovery. This one's really crucial, just in terms of what we spoke about in terms of the habits and forming habits. You as loved ones, also, if your loved one stays in sobriety for that period of time, also internalize and adopt many of these behaviors and habits and rituals that they take on that come with sobriety. Okay. And then in summary, the short answer is everything gets better with recovery. So that 90-day mark really is a crucial milestone, but it's sort of the first big milestone in working in recovery. From there onwards, really everything, if one maintains their recovery, does improve and get better, or at least at the least doesn't worsen. Okay. So I deliberately rushed through this one just to allow some space for more space for questions.
And what we're looking at in terms of creating that foundation of solidifying everything that we've done in primary care, but also even things like 90/90. If those treatment options like primary, secondary, tertiary care, halfway house are not really feasible for the family, your loved one will really benefit from 90/90, which is 90 meetings in 90 days. So this is such a very basic but such a crucial time, the 3 month period, to really for our family members to start really engaging in day-to-day recovery, whether it is in a facility or if it's just outside. A daily reminder, which is what meetings are. They are a daily reminder of why it is so important to remember and remind ourselves of our addiction. So if you think from I'm seeing a question here, but if you see from like just primary care up until outpatient and 90/90 and things like aftercare, we can really see our family members getting better. I'm just going to open the chat so you can see the questions that we have here. I'm seeing Brenda saying we hear a lot about what we should not do, but what can we do, right? Do you want me to go first, or do you wanna touch on that?
You're welcome to jump in.
Hmm. I think, Brenda, in terms of what we can do, we will always give suggestions based on the client's, family background and availability of resources. But after leaving primary care, which is the 21-day treatment, it is best to jump into secondary care treatment, which we call the farm, right? The farm does provide with the same kind of care and monitoring and basic containment that primary care does give, but with a lot more leniency and a lot more ability for our clients to have time to learn about themselves. Calvin spoke a lot about the psychological aspect of, you need to build accountability, understand what accountability means, understand the role that the family, also understanding the role that they play in the recovering addict's life. But beyond that, we have halfway house, which is the in between where they live in a sober house or sober living, but they get to engage in their day-to-day functioning in their lives. So in the 3-month period, those are the most intensive, extended treatment care options. Where we get to more lenient but still quite engaging is outpatient treatment, which we have. We also do suggest outpatient from 6 to 8 weeks, right, following treatment, but it can be, for as long as your family member needs, which is you go to work on a daily basis, and then from 4 o'clock you are able to come to Changes to uh, do group therapy. You're allowed to do individual therapy if you do request that, and then there's also an option for a meeting at Changes. So it's quite helpful to keep familiarity and to just replicate what the client would have been used to, what our family member would have been used to. And then something that is a little bit more lenient, but it's still quite helpful, is aftercare. So that's also an option. It is quite financially feasible as well for families to also be a part of it, contributing, I mean. Aftercare is just virtually what we're doing here. Would be a session on Mondays, Wednesdays, and Fridays where your loved one would be on Zoom in a group therapy session. Mhm.
And then we've got a question here. Is there a higher risk of relapse if a loved one is not attending meetings for support after leaving rehab? The short answer is yes. There is a much higher risk of relapse. So Dr. Tier, you can quote me on the stats, but I believe it's between 8 and 12% chance of recovery after primary care treatment. And if you stay in some kind of sustainable recovery, every month your chances increase. So if you're not attending meetings, you're not sort of following a sustainable recovery plan, which means, yes, your risk is much higher. Would the 90-day sobriety still be as effective, irrespective of the length of time the individual has been in active addiction? Yes. In fact, I'd say that the 90-90 is probably more effective for someone like that. Someone who's been inactive for a very long time actually needs to engage in meetings and active recovery for much, much longer periods, actually attending daily meetings for a much longer period, longer term treatment for a longer time, outpatient treatment. So someone who's sort of fairly in the early stages of their addiction or haven't been inactive for very long, 90 days is crucial for those people. Crucial. I don't know if you want to add to that, in Essentia.
No, I think you covered it quite well.
Okay. What would happen if a loved one went into primary for weed and seems to be a bit angry now that they get out? Difficult one to answer. So I mean, if we just think about the picture that I showed now in terms of the neurological effects, the biological effects, the psychological effects, the environmental effects, primary care is unfortunately just not sufficient to address many of the problems. It's not sufficient to address the emotional regulation difficulties. It's not sufficient to address some of the neurological problems that occur through active addiction. It's not sufficient to recorrect some of the cognitive deficits, even some of the more psychiatric difficulties as well. Primary care is simply just not sufficient in terms of length of time. It's very intensive in terms of treatment, and you can see quite a number of changes. But like we said, it takes 21 days to really start that habit and about 90 days to solidify that habit. So that habit is still in its early phases of actually being solidified into one's daily routines. And then just in terms of that emotional regulation, once again, primary brings up a lot of big emotions, brings out a lot of past experiences that could bring up traumas, et cetera, et cetera. And so when one leaves primary, they can leave in what we call quite an uncontained state. And so, yeah, they might be a bit angry if they don't have further treatment. And that's why we always recommend further treatment, and actually can do more harm than good just leaving primary in that state without sufficient treatment. I see, Kate, you want to jump in?
I just wanted to say, and that just reiterates your point around the 90-90. It's, to continue to 90 days meetings, etc., whether it's inpatient or outpatient or however it be, the program needs to continue irrespective of if it's your first time or your 15th, millionth time. If you've been using, the length of time is always going to have a better outcome than the shorter period of time.
Yeah. And I see Justine asks, if the addict began using before the prefrontal cortex was fully developed at a young age, does that mean the potential brain damage will be worse? Dr. van der Merwe said yes, and this is very clear in studies done on cannabis. Couldn't agree more.
The studies actually shows that you have a 17% increased risk for brain damage if you use cannabis versus not.
And Dr. here, you're going to correct me if I'm wrong here, but that prefrontal cortex only really fully develops between the age of 23 and 26. And so I'm correct in saying that?
You are, but it's quite a huge problem if you start smoking at 16, 17. The risk of, it's just chaos, because you have a risk for decrease in IQ, decrease in emotional development, decreased prefrontal cortex, able to say no, executive functioning. It just continues.
And the permanent damage, I mean, the WHO just released a big statement around alcohol and dementia. The real damage, they actually basically said one should no longer drink after the age of 60. So that's also true in terms of cognitive decline, that many substances have negative effects after certain ages in terms of prefrontal damage that occurs.
And Dr. Tia, is the damage done, is it permanent or is it reversible or is it dependent?
It depends, but cannabis is often permanent. But alcohol, it might be reversible. There's some that they say if you stop, there's some recovery, but some is permanent. And the big thing is that it is often cannabis, which is the one that everybody tells you is so safe. There is schizophrenia is up to 3 times more common than they thought on cannabis. So they already thought it was an increase. Now they just realized it actually is 3 times more common to get it. There's an increase in suicide attempts, quite a lot, almost 3 times as much when people use cannabis. So I've got a whole file on cannabis. It's one of those things.
And is it dependent on how much or length of what is the predictors?
The predictors is that a higher potency has an influence, how much and how young you started using it.
And then obviously the genetic predispositions as well. An individual can use cannabis just once, and
there's about 100 cannabinoids in cannabis. Some are quite common and some is not so common. The common ones, you can smoke for years and not hit one of the uncommon ones, or your first pull can be an uncommon one. So what those are, there's about 4 that's really psychoactive. One gives depression and anxiety and psychosis. It also gives something called the demotivational syndrome, where you don't want to study, you don't get out of your room, you just lie down, sit and play video games, or not even that, do nothing. And that demotivational syndrome can take up to a year to recover from. So your first pull on your first cannabinoid, if you have that cannabinoid in your system, a year has gone out of your life. So people can, they can go for 10, 20 years, but you can just as well have your first one that gets you into a psychiatric illness. Teenagers have a 2 to 3 times more likely depression and suicide. They have 4 times more social problems if they're on cannabis. So they're huge, it's chaos. It's really not as safe as anybody thinks. So yeah, people can say it's safe. I've smoked for 20 years, nothing happened to me, but I haven't hit one of those cannabinoids. That's the problem.
And there's also sort of research that does reviews on all the effects of cannabis, and basically what they've also found is that for every sort of one positive effect that you can find in cannabis, there are far more negative effects from it too. So also don't be sort of fooled into the idea that, oh, it really helps with my anxiety. It most certainly doesn't. If anything, it makes it worse. The positive effects of cannabis usage are very few. Did I understand this correctly? When someone was on addiction for a long time, then 90 days rule might turn into much longer period. Sobriety needs to be a long period. That's the short of it. But that 90-day milestone is actually very crucial in maintaining the sobriety. That's, I think, what we're really trying to drive home here. Obviously, if one is an addict, they should never touch substances again, period. But that 90-day rule will be longer, just by virtue of that fact. But that 90-day milestone and pushing your loved one and encouraging your loved one to get past that milestone is crucial in maintaining recovery. Okay. Then, are there specific activities that one can engage in as part of secondary treatment that a loved one can be part of? Dr. T added that exercise, running, hiking, doing things with loved ones. There's open meetings that families and friends can join, and then you yourself can join your own 12-step program. That one's a really nice one, Dr. T, because I think you also get real insight into the hard work that your loved ones are putting into it, because it's not easy. And following the tenets of the program are not easy. It's gut-wrenching. It's difficult work emotionally. It's difficult work sometimes cognitively. You're facing a lot of the consequences that you may have caused yourself. And that's incredibly difficult work. So if you yourself get into your own program, you really do get insight into the turmoil that they're going through in recovery. Okay, and then we have someone just saying goodbye. Thank you for joining. Are there any more pressing questions for this week?
Mo, you can unmute.
Sorry it took so long. Hi, good evening, everyone.
Hi, Mo.
Okay, yeah, the cannabis is always a heavy one for me, but I've got two questions. I was looking at a massage menu online today. Don't worry about that, and they have a menu with CBD oils in it. And I was just shocked because it's a reputable place, and I'm saying, are there not effects to rubbing CBD oil into someone's skin? Does that not affect you
There
internally?
definitely is effects, and you can't say that it's only CBD. People can't. It costs too much money to really split the two. So there's always some other stuff in there too, and it can have a huge impact. But everybody's in the bandwagon. I bought some really nice treats for my dog, checked all the ingredients, it was fine. They redone the packaging and there was some cannabis in. So that's why my dogs were so crazy about the treats and so sleepy. Yeah. So everything, it goes into everything. You can't do it, and it's not okay. But that's all over the place.
It was horrifying. Second question, can we talk a little bit about benzodiazepines and things like Urbanol and Venlaw and that? Because I have so many friends who take sleeping tablets, and I really struggle with that. And even older people, like older family members. And how long does it take for them to become addicted? And how difficult is it for them to stop? I'm not talking somebody who takes 10 or 20 a day, but people who use it.
It takes 2 weeks. You're addicted to it in 2 weeks' time physically, even if you're on the prescribed dosages. The only place where you can give long-term, according to the registrations at the pharmaceutical company, is if patients have epilepsy, that you can give long-term benzos. There's one that has been registered for anxiety, but only on an as-needed base. All the others are only registered for 2 weeks. The sleeping tablets, 2 weeks. that's what you need to take it for. There is non-addictive sleeping tablets, but the addictive ones, maximum dose is 2 weeks. So everybody that gives a script for longer is breaking the law. Benzos, if you're on benzos for a long time, the decrease is with less than 10% per week. So I often ask people to buy a glass nail file and start scraping the tablets less, or using a crusher, crush the tablets into powder and take it away. It's less than 10% per week if you don't want to have physical effects. And that's on normal dosages. That's not on higher dosages. You are addicted to it within 2 weeks.
Yeah.
Whoa. Thank you.
The really important thing, Mole, is with any of these tablets is to just establish a healthy circadian sleep cycle. That's the point of these medications, especially the sleeping tablets. You just want to establish a proper sleep-wake cycle. So very often people rely on that because they think, okay, this is the thing that's going to make me, fall asleep, and I don't need to kind of engage in daily routines and daily activities that help me establish this routine. So then, I can take it whenever I need at whatever time and wake up at ungodly hours, and I don't really need a routine because I've got this magic pill that will put me to sleep. It's the most important thing for insomnia and sleep in general is to actually just establish a healthy sleep routine.
Okay, thank you. I'm petrified of them, but everybody says, oh, but my doctor prescribed it. So that's why I asked. Thank you.
Then maybe just a comment on what you had said, Mole, as well, in terms of the cannabis and the CBD oil. I always find it so interesting, when you look at a cereal box and it will say low in sugar, low in cholesterol, low in all these, kind of say
So
all the risks, right? But you never see any of these warning signs on an apple. You never see them on a banana. You never see them on vegetables. And so I think a lot of the kind of effects that we're looking for also with CBD also really just come from dietary aspects. We can get many of these side effects that we're looking for just by living a healthy lifestyle.
thank you.
We have 2 questions in the chat. Bali's asking, what are the telltale signs that a loved one might have relapsed? I think maybe let's start with that first.
Social isolation would be key amongst them. Emotionally defensive in general would be another one. Lying.
Yeah, and I think it's also important to realize that a relapse often comes behaviorally before it comes physically. So there are lots of signs. There's resorting to old behaviors, isolating, as you were saying, agitation, any old behaviors that were prevalent whilst in addiction. Have an eye out for those kind of behaviors, because the behavior will be an indicator that a relapse is on the way, and it usually is quite a good predictor of what's to come.
Can I share screen? Can you access me?
Yeah, hang on a sec. Should be able to share, Dr. Tia.
You can take a quick screenshot. This is the medication you can and can't use. Medication to avoid if you want to take a screenshot.
And then maybe
Can
just
and
to add,
can't.
to add to what you're saying, Dr. Tia, in each and every patient's individual recovery plan, we do list the medications there too. So inside their sustainable recovery plan, you as the family should actually be reading through their sustainable recovery plan. But inside of that package, we do list a lot of the medications that they should be avoiding. But I might also just add that Dr. Tia's list is much more comprehensive than that.
Yeah.
So please do take screenshots.
Very much so.
There's also just some antibiotics you can use. Can't just use any antibiotics. Only some antidepressants. Some cholesterol meds, not everything is okay. Some blood pressure medication, not all of them is okay. Don't use steroids if you can help it.
Yeah, there's a question, is triptyline good to use for long term?
It is not an addictive medication, but it does and can influence some of the psychiatric illnesses and makes them worse. So it very much depends on patient to patient. Not addictive, but not necessarily good either, depending on the patient.
Really important question here.
Lovely,
If you can
yeah.
see the behavior is changing and they are starting to relapse, what can be done? Firstly, I think follow Dr. Tia's advice.
Yep.
Take care of yourself. And then boundaries, boundaries, boundaries.
And encourage them to follow their 5 pillars, you know, to contact a sponsor, to get to a meeting, to do some step work around it, encourage and make sure that they, you know, be curious about their recovery, where they're at. So question what's happening for them, what's going on, and try and encourage them to get to a meeting to address some of the behavioral changes that are occurring.
And
I think maybe just to add a little bit, sorry, Calvin, there was a question where they spoke about if a client left primary and they behaving more angry, you know. I think we do really foster that the clients, your family member will know what the right thing to do is. You know, he should know that if he is upset, if he's getting up angry, if he's seeing that his mood is a little bit more on the negative side, he should get to a meeting. She should have a sponsor. There are certain things and certain protocols to follow. And a relapse does start with emotions. There are emotions that we see that start reoccurring. So before we even get to touching the substance, there will be some changes behaviorally, emotionally that we see. And it is always, if you are in a meeting that day, whatever emotion it is, it will usually dissipate if you do the right thing. If you go to a meeting, call a sponsor, you know, do the next best thing for your recovery. So, and I think families do tend to want to take responsibility for where our loved ones are. I think always directing them to their treatment protocol. Have you been to a meeting? Did you speak to your sponsor? It also allows them to take responsibility, because if you are feeling angry, why are you angry? Do what your recovery is requiring from you. And Dr. Tia was quite right. You know, taking care of ourselves helps us be in a more healthy position to direct them to the healthy platforms. Yeah. Sorry, Calvin, I think I cut you off there.
no, you're going to say exactly what I was going to say.
Okay.
Personal responsibility. I mean, yeah, there's nothing you can specifically do, but you can't take responsibility for your loved one's recovery. And if you try to, then the problem won't change.